It's important to distinguish between sadness and depression. Sometimes people will say everybody experiences depression, right? Well, the fact of the matter is everybody does not experience depression, but it is normal to feel sad on some occasions. If you break up with somebody or if you lose a job that you really wanted to have, it's appropriate to be sad and to be tearful at those times. But sadness, again, does not equal depression. Depression is a mood disorder that affects how we think, feel, and handle really all of life's activities. The symptoms of depression include sad mood, hopelessness or pessimism, irritability, guilt or feelings of worthlessness, loss of interest or enjoyment in hobbies or activities that we previously liked, low energy, low motivation to do things, difficulty with concentration or decision making, sleep problems, either sleeping too much or sleeping not enough, appetite changes, thoughts of death or suicide. Sometimes people may experience what's called psychomotor agitation or retardation, meaning they're moving too much or moving too slowly. So how do you know that you're actually depressed? Honestly, you may not. Sometimes it takes other people to point out the changes that they see in order for us to know that something is going on. Your supervisor, for example, at work may say, hey, you're not doing all the stuff that I've asked you to do. Your friends may point out that you're not as active with them as you had been before. People often want to know what causes depression. Honestly, it could happen as a result of a number of factors. Depression could be present because of biological, genetic, or even environmental factors. Depression happens in both men and women. It can start oftentimes in early adulthood, but truthfully can happen at any age. Untreated depression can impact you in so many ways. Your relationships with others can be affected. You can have difficulty completing tasks at work or school. Your physical health can be impacted as well. Heart disease, diabetes, cancer, all of those are much harder to treat if depression isn't controlled. Our immune system is down when we have depression. Infection becomes a lot harder to treat. And our pain is much worse oftentimes when people are depressed. People who have problems with pain typically have very complicated medication regimens. And if you're depressed and having difficulties with concentration, it's hard to follow the recommendations that the doctor sets out.
We want you to live life on your own terms. That's the PTI difference. To make an appointment or join our growing team, visit us at our offices or call us at 225-751-5412.